Bonjour tout le monde, bonjour aux personnes qui sont en salle et aussi en ligne. Je m'appelle Malek Batal, je suis professeur de nutrition à l'Université de Montréal et j'ai l'immense plaisir de vous présenter une collègue, mais surtout une amie de longue date, puisqu'on a fait nos études ensemble à McGill il n'y a pas si longtemps que ça, en doctorat. Dr. Noreen Willows est avec nous aujourd'hui pour parler de sécurité alimentaire comme échec politique. Noreen a un background en nutrition. Elle a un doctorat en nutrition de l'Université McGill, mais elle a aussi un background en anthropologie, en archéologie. Elle est donc anthropologue nutritionnelle. Elle s'intéresse aux questions du droit à l'alimentation, des questions de sécurité alimentaire. Elle a travaillé longtemps avec différentes communautés, notamment autochtones, à travers le pays, au Québec, en Alberta, en Colombie-Britannique. Noreen est depuis très récemment professeure émérite à l'Université de l'Alberta, mais elle continue de faire de la recherche, elle continue d'enseigner. Donc, on a l'immense plaisir de l'accueillir aujourd'hui pour nous parler donc, de sécurité alimentaire. Welcome to Montreal, Noreen.
See, hello everyone. Thank you so much for being here, and thank you for the invitation from Dr. Malik Patel, who I've known for a very long time, 30 years. And I'm also here invited as well by Dr. Roseanne Blanchet, who was my postdoc. And we're still working together on research papers. So, and I see friends in the audience as well. So thank you everyone for participating today and taking an hour out of your day to listen to me talk. It's my great pleasure. So I would like to talk to you today about food insecurity in Canada, and how, despite the fact we've been measuring food insecurity on national surveys since 2005, so this is a problem that we are aware of, we have failed to act. And so the question I always ask is why? Do we measure food insecurity at great expense and recognize that a problem exists and then really do not develop appropriate policies to correct the problem? To me, it seems unethical to be aware of a situation and yet do nothing about it. But that is what happens in Canada. So I will describe to you the food insecurity situation in Canada and the policy options that could potentially address the issue if we chose to act on it. There we go. So several of the slides in this presentation I've borrowed from the Proof website. For those of you who are not aware, this is a website out of the University of Toronto that is an excellent resource for information about food insecurity in Canada. It also collects peer-reviewed articles related to food insecurity in Canada. Almost all of the information you can share publicly. So it's a tremendous resource. So for those of you who aren't aware of this website and would like to know more about food insecurity in Canada, I suggest that you visit it. Okay, so I'm first going to start this presentation talking about how in Canada we monitor income-related food insecurity. So food insecurity is measured at the household level, and we measure food insecurity narrowly. So it's income-related household food insecurity. So we don't measure community food insecurity, for example. We don't look at individuals who are food insecure. We look at households that are food insecure on one dimension, and that is their financial inability to acquire or obtain food. So just to be aware that there's other dimensions of food insecurity that are not captured in Canada on these surveys that I'm going to discuss. So in Canada, the decision was made when Food insecurity was first included on national surveys on the 2004 and 2005 Canadian Community Household Survey to borrow the same survey tool that is used in the United States. It's a tool that was already validated for use in the United States, and it has allowed very interesting comparisons between the countries by the decision to use the exact same tool. And so what is measured using that tool, there's 10 questions about adults in the household and 8 questions about children in the households, is if the household reports over the prior 12 months, so at any time in the prior year, if that household had uncertain, insufficient, or inadequate food access, availability, and utilization due to limited financial resources. So every question asks about as a lack of money for the reason for being food insecure. So it's very much an income-related perspective on household food insecurity. And as I said, it is a validated tool. Australia is now using the same tool. I did a sabbatical in Australia 2 years ago, and draft a little bit of a statement with my colleague why in Australia this tool should be used as well. So now we can have many cross-country comparisons, including in Australia. That data from Australia should be available soon. So based on responses to these 18 questions, households are categorized as being food secure, meaning they have no income-related problems for food access. And that is the majority of households, thankfully. So these households are like, we're okay. You know, and never do we ever have concerns that we cannot buy or afford food. Then based on the number of affirmative responses to those questions, households can be classified as marginally food insecure. So these are households where they get by, but they're always a little worried. Like maybe the money that we have won't last. But they're okay, they can feed themselves, but they have anxiety about limited income. There's moderately food insecure households that start to make changes to the way they eat. Maybe they buy cheaper food, for example. They're starting to budget. And then the severely food insecure households are households where there's likely hunger. People are skipping meals, they're going without food, they're reducing the amount of food that they eat. So this is the most severe case of food insecurity. And food insecurity, as I'll show you, it's detrimental to health and well-being. Even at those marginal levels where people are just worried, we can see impacts on health and well-being. They're stressed, they're concerned. And then, of course, as the situation gets more severe in the household, the health outcomes get worse and worse. It's also a marker of material deprivation. So when households are food insecure, they're not just budgeting on food, right? They're starting to be deprived of other essentials. So I'll show you a slide where these households may make decisions to not fill their prescriptions, right? So it's a marker of broader material deprivation. These households are suffering in many dimensions, not just food. And because of that, because you have to pay for heat in the winter in Canada, because you have to have a roof over your head when it's snowing, the decision may be made to go without food, to heat your home, to have an accommodation. Oops, there we go. So this household food security survey module is included on 2 large national surveys run by Statistics Canada. the aim is to achieve a representative sample on those surveys. And as I alluded to right at the beginning, these are expensive surveys to conduct and analyze, right? And so you would assume if data is being collected, you're collecting it so you can act on it, so you can do something about it, right? It's not just information for the sake of having information. So since 2005, this information has been included on the Canadian Community Household Survey. I analyzed that first survey with one of my colleagues, Paul Vogelers, because on that survey, they intentionally oversampled Indigenous households so that we could understand the situation on Indigenous households. So we published a couple of papers on that. And then since 2018, the exact same survey module has been included on the Canadian Income Survey. And the decision out of proof, Valerie Tarasak, who's now retired, and some of her colleagues have described why they think that using information from the Canadian Income Survey is actually better. The response rate is higher, and the data is collected annually, more frequently than on the Canadian Community Health Survey. So I think in the future, most of the information will come from the Canadian Income Survey. It's considered to be more robust, more reliable information. So Statistics Canada tries to make sure that these are representative samples, but some very vulnerable groups are not included on those surveys, although they represent less than 5% of the population, so a very small portion of the population. So these are Indigenous people living on reserves and other Indigenous settlements in the provinces, the institutionalized population, and very remote communities as well in the north. It's just very difficult to sample those communities, so they're not included. But on a whole, it's good representation of people living in the 10 provinces. Okay, so for Indigenous peoples, because data may not accurately reflect them, there are other surveys that take place for the Indigenous population. As I mentioned, for the off-reserve population in non-remote areas, they are included on the Canadian Community Health Survey and the Canadian Income Survey. And then there's also an Indigenous Peoples Survey of First Nations people living off-reserve, Métis and Inuit. And then Dr. Malik Patel conducted the first survey, the First Nations living on reserve south of the 60th parallel. This was a huge undertaking. There's many, many publications that came out of FNES that report a similar situation to all of these other surveys, that food insecurity among Indigenous people is much higher than among the non-Indigenous population. And then there's also smaller regional and community studies. For example, Dr. Patel and Dr. Blanchet, who's in the room with us today, we have been working with Indigenous peoples in the interior of BC, and we've published on cultural food security, which is a bit different than income-related food insecurity, where people feel that to be food insecure, they need the foods of their culture, their traditional foods. So we've been working on that with those communities. It's been very interesting information. Okay, so we collect this information, and so what does it show us? So I'm going to talk about the prevalence of household food insecurity. So in Canada, using this survey, we do not measure the percentage of people who are food insecure. We measure how many people live in households that are food insecure. So this is a question I ask students on my exam, so it's a little different. So not everyone within a household is necessarily food insecure. For example, we know that parents protect their children. So in a household with food insecurity, it's more likely that parents will go without food so that their children can eat, okay? By the time children are hungry, households are desperate, right? Parents have no longer been able to protect children, which is why questions are asked specifically about children in the household, although there are some issues related to that. I won't go into that today. So this is the latest information, and I hope that these numbers show up for you. I've copied this from the Proof website. So this is the latest information from the Canadian Income Survey. In 2023, almost 1/4 of households in Canada were food insecure in the previous 12 months. So at some point in the previous 12 months, they experienced food insecurity. It's a dramatic increase from the previous year. It was high the previous year at 18%. It went up to almost, 23% in 2023. So food insecurity has increased dramatically in the past year. And I'll just allow you to pause for a minute and look at these results. So Quebec is doing something differently than the other provinces. Food insecurity is still too high, but it's almost half that of some of the other provinces, right? Where we're getting here almost 30%. And Alberta, my province, the province that has been characterized as a wealthy, a rich province, we don't do so good protecting people. It's almost double. So why? I suggest it's policies in this province. Policies to protect people from poverty. So we could borrow from this province. But still Quebec too could do better, right? Oh dear, let me go all the way back. I pushed the end, I apologize for that. Okay, so Quebec is doing better, could do better though, and on a whole, we're not doing well in Canada. Now, so this is data for the 10 provinces. There's separate reports for the territories. The numbers are smaller, so, they may not be quite as reliable, but they're consistent. Every year it shows the exact same thing for the territories, that food insecurity is much higher in the territories. So this is the Yukon, the Northwest Territories, and Nunavut, where it's estimated that more than 1/3 of households in those territories combined are food insecure. And then the situation in Nunavut consistently over the years is much worse. So almost 2/3 of people in Nunavut live in food insecure households. And that's likely just because of the higher cost of goods and services in the north. It's just, even though in some cases incomes are higher, they're not sufficient to cover the increased costs of goods and services in those regions. So what are the risk factors for food insecurity? Well, not surprisingly, it's low income, because that's what we're measuring, right? So when I'm talking to people who've not been introduced to this topic before, when I talk about food insecurity, sometimes the response is those people just need to go and get a job, right? They're lazy, they're not working enough, they're unemployed. Well, that's not the case at all. If we look at the majority of people who are food insecure in Canada, they're the working poor. They're working low income, minimum wage jobs. Jobs that are temporary jobs, jobs where they're not given full hours, because then their employers would have to pay them benefits. So they're maybe working 2 jobs, they're maybe working 3 jobs. So the food insecure don't need to work, they need to be paid, and they need secure employment. So the working poor, people in the food industry, for example, temporary workers. But if you're not working, you do not want to be reliant on social assistance. So social assistance at one time, post-World War II, when it was rolled out in the 1960s, for example, was much more generous than it is today. Social assistance once served as a security net. The point was to catch people before they fell into poverty, right? They were in a situation where they needed a reliable source of income to prevent themselves from being poor. And so this, you know, I think the 1960s and 1970s, we had a much more generous social assistance in Canada. And then in the 80s and 90s, we decided, I guess, that these people deserve to be punished. And the amount of social assistance has become diminished to the point where these people are living mostly in poverty. Often these provincial programs, there's a penalty if you work. Money is clawed back from social assistance. And so people get into a cycle where they cannot exit poverty because their situation is so dire. And I didn't laugh because I think it's funny. I laughed at the irony of something called social assistance that does not assist people effectively. And what we are doing right in Canada, although senior citizens, yes, there are senior citizens who are food insecure, but on a whole, our programs for senior citizens are doing their job. They're protecting the aged, the people over 65 from abject poverty, right? Yes, maybe they can't go out and buy a big car and go to Hawaii, but it seems to be protecting them from income-related food insecurity. So that's a good thing. So we could look. Seniors' public pensions are indexed to inflation, so they increase. They guarantee people a basic income. That's exactly what social assistance should be doing, and it's not. So a policy failure, a big policy failure. So senior citizens are doing fine. Households that aren't doing so well are households with children. So if you compare 2 adults in a household without kids, they do much better than households with children, despite the fact that we have benefits for children in Canada. They're obviously inefficient. And I'm sorry, I don't know why this is up here. It's not covering anything, so I won't make it go away. So again, if we look, households with children are more likely to be food insecure. Female lone parents with children. These are dire situations. Male lone parents do better. They represent a much smaller portion of lone parent households. Females looking after children on their own, almost half of those children are living in food insecure households. We're failing these families. We're failing these children. Again, when we look at these results, and I'll just walk you through these. So this bar, these light bar is 2019. This is 2020, 2021, 2022, 2023. So the dark bar reflects last year. You can see consistently for every province, almost, the rates are going up from the previous year, not in Quebec. Only province that didn't see an increase in household child food insecurity. And on a whole, Quebec is the best protects children, although can still do a better job, 1 in 5, right? So we can learn. The rest of the provinces can learn from Quebec. Something is happening here. Someone has made the decision that children are worth protecting. So whatever's working, fight for it. Don't let those policies be diminished, right? Because they're good policies. Renters are more likely to be food insecure than homeowners without a mortgage. But of course, these people, their biggest expense is gone pretty much, right? And they're probably from a higher income household anyway. They've managed they own their house, right? Outright. People who are renters, in Quebec, there's rent control. In Alberta, there's no rent control. So you're on a budget, you do not know when your lease is up, your rent could be doubled. It could be tripled. You cannot save for that. You cannot prepare for that. So it's called an income shock in sometimes, you know? The minimum wage has not gone up in Alberta, for example, since 2018, and yet your rent can double. Your income has not changed. If you rent, you don't have equity, so you can't get a line of credit. If you need to borrow money, you put it on your credit card. And what is credit card right now? 20%, 25%? You can't get out of debt, right? You have no equity. There might be, where housing is limited, rent is high. So renters struggle to put food on the table. Because both of these surveys ask people about their ethnicity and their race, we can classify people based on their self-identified identity. And we know that households where the respondent identified as Black or Indigenous do worse. So in Canada, white households, 20% of those households are food insecure. For Black households, it's double. Double. That's astounding that one group should fare so much more poorly than another group. Chinese households also are very similar to white households in Canada. And so Valerie Tarasik and her colleagues have tried to dive into this. What is going on in these households? And so they control for factors. Well, maybe it's income. Maybe it's education level. But when they control for all of those things, Black and Indigenous households still are more likely to be food insecure. So it's unmeasured factors. Something else that's not well understood is going on in those households. Their suggestion is it's racism, racial policies or colonial policies. People are denied jobs, they're denied housing, for example, because of their race and indigeneity. And unfortunately, in Quebec, Quebec fails Black households as well. They don't fare as well as other households. So although on a whole, we can commend this province for protecting people, they do not protect Black households the same as they protect white households. And that needs to be examined further, right? Because it's a disgrace. So, what are the outcomes of the fact that so many households in Canada are food insecure? I'll show you some of the data that I've done on academic achievement, both among children and among university students. The implications for diet, health and well-being, healthcare costs, that comes from the group that works at Proof, and higher premature death. People do not flourish living in food insecure households. So this is a study that I worked on with Dr. Paul Willows, who's in the School of Public Health at the University of Alberta. So I helped with this work. Paul had done a study of grade 5 students in Nova Scotia. This data was collected in 2011, so it's getting a little old, but I don't think much has changed in terms of what happens in food insecure households. And we discovered that children in households with very low food security, so severe, moderate food insecurity, were less likely to do well on their standardized exams for reading and mathematics. So this means children's ability to learn in those households was compromised. And that's probably because these are households characterized by stress and uncertainty. They're not environments that are conducive to children being able to focus on learning. Even if these children were not themselves hungry, their parents probably were, their parents were stressed. So these kids just did not do as well on standardized provincial exams. Using that same data, and Dr. Blanchet, who's here today, assisted with the analysis of this data, using the same survey data from Nova Scotia, we also found that children living in these households had lower self-esteem. They didn't like themselves. They weren't happy with who they were. Who wants a child at this age, such a young age, saying, I don't like myself. People don't like me, right? Because it's huge implications for children's health and well-being to have low self-esteem. Again, they're likely living in households that are where there's the parents are insecure and financially. Children just don't have confidence coming from a food insecure household. And then I had a number of my graduate students work with me on a study where we looked at university students at the University of Alberta who were food insecure. We had them do the household food security module, and they were using the food bank on campus. And we asked them both qualitative and quantitative surveys about their experience with food insecurity. Students said that their academic performance was compromised. They couldn't concentrate in class. They couldn't concentrate on lectures. Some of them just said they were sitting there hungry. They were constantly worried about being able to feed themselves. Sometimes they didn't go to class because of their situation. They did not go to exams. Some of them said they were so hungry, their body temperature they would feel cold, right? How do you concentrate when you're experiencing that level of hunger? So it adversely impacted their physical health, their mental health, their social well-being, their academic performance. And as I mentioned, some of these students reported extreme food deprivation. And food banks, almost every campus across the country now has some sort of food hamper, food pantry, food bank for students. It's impossible for food banks to supply enough food for everyone who needs them, including on campuses, right? So these students could access a food bank once every 2 weeks. They were desperate. The food bank provided them with short-term food, but not enough to alleviate their situation. And so we looked at the dietary intake of these students, and not surprisingly, their diet quality was poorer than other students. They consumed fewer fruits, vegetables, and legumes than other students. And so it's been reported over and over consistently that household food insecurity is a predictor of poor diets and unhealthy eating patterns, and that adults, for example, this is a recent study in food insecure households, have all sorts of micronutrient deficiencies. So not surprising. All sorts of studies over and over and over again out of Canada and the US consistently show the same outcomes. All sorts of nutrition-related chronic diseases like diabetes, injury. Many of these people are in low-income jobs, working at occupations where they can hurt themselves. Construction, for example, they rate their health poorly. They may be obese or overweight. I don't think people consider the mental health outcomes, the adverse mental health outcomes of food insecurity, anxiety, chronic worry, distress, depression. For children and youth, again, even if they themselves are food secure, they're living in households where parents are probably anxious, distressed, and depressed. And so children have mood disorders, learning difficulties, as I explained, low self-esteem, behavioral problems, depression, suicidal ideation. Again, low self-esteem, you don't like yourself, right? So terribly compromised health, potentially when people are food insecure. And so I want to show a chart. So I'll just walk you through this. So this is down here are different examples of mental health, things like depressive thoughts in the past month is the green line, the blue line, suicidal thoughts in the past year. The red line is major depressive episode in the last year. So yes, food secure people do have mental health issues, but we can see for every level of food insecurity, including marginal, moderate, and severe, these problems increase, with severely food insecure people being severely compromised in terms of mental health. But even those people who just worry, of course, worry, stress, have a higher prevalence of these various things like mood disorders and a physician-diagnosed anxiety disorder. This graph, again, from proof, for this chart, shows adults in food insecure households that are more likely to be admitted to acute care for all sorts of things like endocrine-related diseases like diabetes. So compared to food secure households, the light pink is marginally food insecure. Here's marginal, here's severe. You always see the same pattern. As the severity of food insecurity increases, so is the likelihood of these conditions. But even people with worry and concern are more likely to experience these conditions. And shockingly, mental health disorders are the ones that you see the most dramatically in food insecure households, with severely food insecure people 3 times as likely to be admitted into acute care for a mental disorder than someone living in a food secure household. This is data that I just published again with Dr. Blanchet. We looked at the Canadian Community Health Survey, and we looked at the combination of having Indigenous identity and being food insecure, because we assumed that the combination of those 2 factors would have the worst outcomes for health. And we found that compared to food secure non-Indigenous adults, individuals who were both food insecure and Indigenous had almost double the likelihood of a chronic health condition that had been diagnosed, were 3 times more likely to perceive their health as poor, almost 4 times more likely to have a chronic mental health disorder diagnosed by a health professional, and 4 times more likely to have self-perceived poor mental health. So I'm going to pick up the pace a bit. I just got my 5-minute warning. So these people, food insecure people, have poor health. They're less likely to, or they're more likely to delay, reduce, or skip their prescription medications due to cost. So they need them, but they're less likely to take their medication because they're too expensive. Maybe the National Pharmacare program, once it's rolled out, will prevent that. So being food insecure is very expensive. Food insecure people have greater healthcare utilization, visit physicians more often. And so if we want to reduce the burden of healthcare costs, we need to reduce food insecurity. So what are the solutions? So this is a chart that shows that the most ineffective solution is food charity, giving food to people. The most optimal solutions are to give people an income that lifts them out of poverty, a minimum wage that's a living wage, and social security benefits that function to keep them out of poverty. And I'm going to go through those quickly. And we also need to address other insecurities such as rent control. You know, no one should have to, at the end of the year, be told that their rent has gone from $2,000 a month to $4,000 a month. It's ridiculous. How can anyone budget for that? So food insecurity is a human right, and it's a social justice issue. As a wealthy country, it behooves us for both of those reasons to ensure that people are food insecure. We need to make sure that people who are working on a minimum wage get enough money that they can meet their basic needs, because the minimum wage is the living wage. We need to lower the income tax rate for the lowest income households and make the wealthiest in society pay more proportionately. We need to make sure that social assistance benefits are increased to at least meet the basic needs of people, and that they're indexed to the cost of inflation, which they're not in Alberta. These benefits haven't increased in years, and the cost of living has increased. We need to increase provincial and federal child benefits, because as I showed you, children living in households or households with children are more likely to be food insecure. So, for example, the minimum wage is pretty consistent across the provinces. In no case is it a living wage, meaning someone working 35 hours a week on minimum wage in no province makes enough to cover their basic needs. If you look at what is required to be out of poverty. So in Quebec, the minimum hourly wage is $15.75. In Alberta, it is the same. I don't have it here. So in Edmonton, where I live, the minimum wage should be $22.25 per hour. The minimum wage is $15 an hour. It has not been raised since 2018. That might explain why we have so many food insecure people in the province. Why don't we have a progressive income tax system? The wealthy continue to make money. I mean, right now, if you are able to invest, your investments are going through the roof. People who make money are protected to make even more money in Canada, because they can put money into savings, and they can claim things like capital gains that it's not possible for low-income earners to do. So we don't have a proportional tax system in this country. The child tax benefit perhaps should not go to high-income families. It goes to everyone, it's universal, but maybe we should preferentially give the child benefit to lower-income families who really need it. Maybe it should go to families who are lone parent families and families in remote locations. So why do we reduce it once a child turns 6? 6-year-old children need as much money as 5-year-old children. We start reducing the amount of money that households get. So it needs to be revised. social assistance benefits need to increase according to the cost of living, and they need to be increased to a level where they bring people out of poverty. They should be lifting people up, not throwing people to the ground, right? So they don't work. There is a situation in Newfoundland and Labrador where the benefits did increase and actually halved food insecurity among people on social assistance. Proof that, yeah, giving people more money lifts them up out of poverty and makes them more food insecure. I'm not going to talk about universal basic guaranteed income because it will never happen, but theoretically, it would actually potentially save money because you can get rid of all these programs that aren't working, that are very expensive to run. Just get rid of social assistance. Make sure everyone at all times has a basic income. No one ever falls below the poverty level. So it's a nice theoretical concept. We know it kind of works because in a sense, that's what senior citizens have. They have a guaranteed basic income indexed to the cost of living. And I'm being told I have to hurry up. So as health professionals, what should you do? So don't victim blame. Maybe people are not able to do what is asked of them because of the circumstances in their lives. They can't fulfill their prescription education. Screen your clients for food insecurity. Consider the social determinants of health when you're meeting with clients. Give them realistic goals that they can achieve given their circumstances, and find out in your local community what resources that they can access. What do we need to do? Advocate at all levels of government for income-based solutions, not food charity. Educate others about the causes and consequences of food insecurity. Bring this information to other people you're talking to. Learn about colonialism in Canada. Support Indigenous food systems. Learn about anti-Black racism in Canada and its impacts on the social determinants of health. Collaborate with poverty reduction groups. And if you're witnessing food insecurity, speak publicly about the need to address food insecurity and to improve the social determinants of health for groups that are vulnerable. So thank you very much for your attention today.
Thank you so much, Noreen.
No, annulé.
Okay.
Yeah.
On va prendre les questions dans la salle et en ligne.
Et puis, vous pouvez poser vos questions en français si vous le désirez, and I will translate. Est-ce qu'il y a des questions dans la salle?
Just curious, thank you so much for your presentation. I'm just curious if you can dig in a little bit more and share with us a bit more of your analysis around why Quebec's food insecurity is so much lower. Because, you know, the stats you shared under minimum wage definitely don't demonstrate that. And from what I understand, social assistance programs are not that much better than our neighboring provinces. So I'm just curious.
Yeah, and so Roseanne has read a paper talking more specifically about some of the policies that we'll share with graduate students this afternoon. Quebec has consistently for the past couple of decades actually had a strategy to try to prevent poverty. And so there is a network of programs that, although they are failing people, seem to be better. I mean, that's the only explanation I have, and maybe Roseanne can address that too, because it doesn't, people are taxed. Taxes here are different. So, and the taxes seem to be going to social programs that are somehow lifting people up. I mean, I'm not 100% sure. I haven't looked into the program specifically, but on the Proof website, they do say that at least this province has the goal to prevent people from being in poverty. Now, and you're more aggressive. Like I know the provincial government here right now is trying to get the federal government to increase benefits for seniors starting at 65. So there's a bit of a war going on with the federal government saying we cannot afford that. No other province is asking that. So I think people here fight more for poverty. And, you know, not all poverty is income related. There could be other things going on. Maybe food access is better in this province for some reason. So I cannot answer your question with 100% certainty. Do you, Roseanne? No, okay, and Roseanne lives here.
I raise that only because I know I was involved in the food movement for a long time, and I know, for example, that there's the Breakfast Club in Canada, right? Not necessarily a program that I would strongly advocate for all kinds of reasons.
Yeah,
but extremely prevalent and present in a lot of schools, especially in communities that have high food insecurity. And from what I've read about is that alleviates a lot of pressure and stress on parents because they know their kids are at least going to get a square meal in school. So I just wonder in your analysis, you're not just simply looking at kind of the sort of what we think of as the formal public health system when it comes or you know, income assistance policy, but what's going on in the nonprofit, non-governmental sector.
And I agree with you exactly. Now, Proof is very adamant. They often discredit. Yes, they discredit the national lunch program. They say, no, the only solution is giving people more money. But I do think that there is the potential for nonprofit organizations, especially if they're very pervasive and effective, to help people a little bit from dropping through that net. So I do think there needs to be more conversation around food programs, not just income programs, and maybe a different perspective on the benefits of those programs. Now, so Proof currently it does not want the national school lunch program to be discussed as preventing food insecurity. So
I might have something to add because I'm thinking about policies that are different in Quebec than other places. We have daycare that is taken care of at a very low cost. We have also prescription drugs that are insured. Quebec and the rest of the country is trying to emulate Quebec in that sense. So these are some perhaps examples. And I'm thinking also about housing, although we are in a situation currently where housing is short and very expensive in Quebec, but if we compare to Ontario, it's really much lower. So maybe combinations of issues that are also economic and beyond just the social programming might be also.
Maybe I can jump in and add a question that was online that's related to what you mentioned. So someone asked, what about the school food universal school food programs in the provinces for households that are suffering from food insecurity?
Yes. So we do, I just talk about my own province, Alberta. We do have those, but it's for low income schools, which is problematic. So the National School Lunch Program, once the federal government and the provinces stop arguing over how that money will be given to the provinces and how it runs, possibly may help. But again, should that program be universal or targeted? Do all schools need it? And how many children will it lift up out of poverty? I'm not sure. I mean, those programs could look so different depending on who runs those schools or who runs the programs. So there is controversy, as our audience member said. Some people just think if you give parents enough money, they can feed children themselves.
We have a few more questions online. I don't know if there's any more questions in the room. Okay, let me ask.
I have a small question.
Okay, go ahead.
I was wondering if you've had the opportunity to engage directly with policymakers, or if you can speak to, you know, researchers or organizations that you know have engaged directly with policymakers around the subject.
Mostly I just do the research and then hope that the policymakers will pick up on the information and do the right thing or try to implement it. So have I worked directly with policymakers? No. I mean, my role mostly is to talk to the media and report the findings of the research.
I don't want to put you on the spot, Amanda, but we have Amanda Sheedy with us in the room who was with Food Secure Canada until for many years.
Oh, yes.
Federal level that advocates for, and the Canadian Centers for Food, no, I always get the name mixed up. Centers, Canadian Food Security Centers, Canadian Food Centers Canada, there it is. Also do a lot of advocacy around poverty. But I think because of if you're looking at income advocacy, you know, there's the Canadian Centre for Policy Alternatives, there's all kinds of, if you broaden it beyond food security, there's actually a lot more actors in the field organizations. And then the provincial level obviously is where a lot of that work really has to happen. Like you said, in Quebec, there's people who've been community depuis longtemps.
Online questions.
Yeah. One more online. I'm just trying to see that this is okay. Because two from the same person. I just want to see if I can put them together. Okay, it's a little bit abstract. I'm going to try to translate it accurately. Okay, it's here. So is it enough to act on income? Especially like knowing about the commercialization of goods, of essential goods like food, logement,
Housing.
and other. And those often lead to increased costs and profits for the private sector.
I mean, had I had 2 hours, I think I could have delved more into these other situations, like the concentration of organizations that sell food has got smaller and smaller and smaller. The ability for small grocers, small organizations to influence food sales is dramatically diminished. And these are big businesses. Can you actually control the price of food in a capitalistic society? Highly unlikely. There is also the case, sometimes people say, well, you know what, if you increase the minimum wage, businesses will just know people have more money, so the price of everything will go up. So it will be like a rat race. So there's many other ways that we could target food insecurity through, I mean, if we think that something like milk and fruits and vegetables are essential for health and well-being, could we limit price increases on those? I mean, these are all questions. Quebec is much better, I think, with food sovereignty than other provinces. You have local food movements. Yeah, so I wasn't able to, I mean, there's many different policy aspects that are needed other than the ones that I mentioned.
Thank you very much.
We're good.
Thank you all. Thank you, Noreen.
You're welcome. Thank you, everybody.